bunch of other stuff.
Okay, I'll have to. I'm not at a place where I can write it down, but I'll either have you send me a link to that, or have you remind me what it is, and I'll write it down when I am stopped at a place where I can do that.
It's already on your computer, honey.
Ah, man,
I knew that was her.
I love it.
You can't hide under that synonymous name or fictitious name, whatever it is.
I'm here with
Hey,
Lydia.
y'all.
We've
I don't
been
know.
making pumpkin bread and jamming to her Halloween playlist.
Are you sharing?
Sure.
Pumpkin bread.
Oh, of course.
We like pumpkin bread.
I know. First batch of the season.
Kim just got done with school, so we're eating dinner.
Yep.
Yeah.
What are you doing school-wise, Kim?
I'm taking a class on regulatory affairs for animal health products, and the focus this semester is EPA.
Wow.
It's pretty interesting. We have a group assignment, so I was just reading the text from my group. There's two of us.
There's only 2 students?
It's just two of us
Our
in a
group.
prepared
Oh,
us to do a group assignment. So next week, instead of meeting for class, we'll meet for to do this group assignment. I mean, just the two of us, but anyway.
Just the two of us.
I took a break in the spring, and then now I'm in a class again. And then I decided to go ahead and get my master's.
Boy.
What?
Nice.
Pam.
Hey, guys.
That's Lila. I think. Hold on.
Hi, Pam.
Hey, Lydia.
Where's your water? Lydia just started volleyball. She had her first games yesterday.
Nice.
How did they-
cheer her on sometime?
That's nice. Sorry, Kim, were you asking me something?
I said, how'd they do?
Good.
Yeah, they did great. It was fun to watch.
Hey, Charmaine.
Hello.
Hi, Charmaine. Sorry about the misinfo.
Okay. Me too.
Glad you're here.
What's up, Charmaine? My neighbor.
Hello.
Interestingly, due to the events over the last few weeks, it's sparked off a good number of conversations really about COVID, and clearly there's been some either confusion or people are paying to different things that have been said publicly, and so we're going on different facts. And Pam and I were trying to wrestle through even what we think of it as a couple, and how what we think is kind of differs. So it was cool to get Eric. Eric Herger is our family MD, and so he does talks about a good number of things. I guess James, you even said that he does talks in the hospital.
We've gone to a couple.
Yeah, I've been not related to COVID. I haven't been a part of any of those, but I've been a part of some different topics there where he's come in and presented. So yeah.
So yeah, I'll watch my text to see if he's trying to get on and can't. But in the chat, I shot out a hyperlink to various questions that I handed to Eric in preparation for this Zoom call tonight. So if you wanted to look at that, you certainly can. Just take a look. he doesn't think it's a different day. I contacted him earlier today.
I said, somebody knocked at the door a few minutes ago. It was one of the campus kids coming by to get something. And at first I went to the door and I thought, it wouldn't surprise me if I opened the door and he was standing there saying, I'm here to do it. So, like, cool. Maybe I should check with the partner because he'll probably ride his bike over if he comes.
I also talked to Chris Kafka about this very same thing. And I didn't want to have two doctors on giving facts and opinions about the same thing, because I just didn't want differing information coming to us. They'd probably be totally in alignment with one another, but I don't know that. Yeah. Hey, copies.
Hello,
How you feeling, Terry?
doing well. Computer is giving us troubles tonight, so we're just gonna call in with my phone.
Do the telly.
We see you. Are you feeling better?
Yes, yes. How's your son doing tonight?
He slept through the day and then we just got off the phone with our grandson in Atlanta. And, you know, he's feeling lousy with the COVID, but he's getting better each day. So
How old is your grandson?
16.
Okay.
Yeah, football. So they get pretty much the whole sport exposure down there. He got over the flu 2 weeks ago.
Sorry, I didn't know I didn't know your grandson had COVID.
We found out yesterday morning. And then,
Oh, sorry. Hopefully he will.
yeah, he's at home. Yeah, he's day 2 with the runny nose and cough and fever, but he's not in bad shape. He gave us his Christmas list just now when I was talking. He goes, I've had time to make my Christmas list. I thought, that's not the purpose.
Had time to.
That's probably a good thing that he feels good enough to give you his Christmas
Yeah,
list.
yeah. So we talked a couple times today, but
So, okay, so the doc is logging on now. So we'll get started here in a moment.
Not a problem.
So I think for the sake of the copies, I was just saying a little bit about Dr. Herder. So he's actually our family MD, but he flits around and does little talks on various medical issues. So he's had occasion to do talks on COVID as well. So I thought he'd be a great guy to maybe start answering some questions. In the chat, there's a link to some questions. Put them online so we could see any questions that have come our way that he might try to answer tonight. And he's texting me right now. Don't you love how you get that a little ellipsis that makes you look forward to the fact that somebody's actually texting you?
Except for when you see it and you're eagerly waiting to see what the response is going to be, and then nothing ever comes.
yeah.
And they're slow, like they're just slow with their thumbs.
Oh, they deleted it. They were going to type it and then they deleted it.
Yeah, that's right.
I make so many typos that people are like, oh no, what is she typing this stuff?
Yeah, I was just getting that ellipsis from him and then it went away. So he's not typing it.
Hope he's all right.
You should. So James said he tried a link last night and it went to some young couples talk.
No, we
about-
tried to link tonight.
Here he is.
Yeah, we tried to link tonight.
Oh, gotcha.
Hey,
Hey, Eric.
He's muted.
You're muted, Eric.
Then I was on mute too. All right. So you guys missed my apology.
That's okay, you can say it again.
Yeah, I started a project that would have, I was hanging a TV mount and we decided to change walls and I got busy and anyway, I apologize. I'm glad Steve texted me. So, well, I'm Eric Herder. I'm an internist here in town. I've been here since 1999. I do primary care. I grew up here in Kansas, in Pittsburgh, Kansas, then went off to Boston College for university, back to KU med school, and then Emory for university. And then my wife and I settled here in Lawrence in 1999. So yeah, and I obviously having a hot topic these days, and it's good to talk about it. I like real dialogue. I think, you know, we've so much of the dialogue has become impersonal, you know, which I think, you know, really detracts from having meaningful dialogue. So I know that this is still virtual, but at least it's face to face, and there it can be interactive. And I know with the topic at hand, like all topics in medicine or science, you know, even things I learned, you know, so many things I learned about in medical school, we understand a lot differently these days. And, you know, with a pandemic and a crisis, the attempts to learn about it are happening on the fly, but it's science is very imperfect and malleable, and you know, they're not absolutes. So anyway, I know Steve sent a list of questions, and so certainly I can speak to those, but I'm very happy just to, again, make it more interactive as well. I guess, Steve, you organized it. I'm not sure what your preference is.
Yeah, I'd like you to, so can we just start by addressing those questions? I think those, even your answers to those will drum up more questions, and that would be seed for conversation.
Okay. So can you guys still see me? You guys can still see me when I was looking at the emails? Okay, because I've got them pulled up. All right. So I've just got them pulled up for myself. So some of the questions I got. So the first one, does a vaccinated person still shed the virus? And the simple answer is yes. And maybe that'd be a good jumping off point right away to talk about sort of an overarching theme. I've sort of gotten into the, and I'll expound on the question. One analogy I like to think about commonly is that of a war or invaders when we talk about viral illness. And like I said, with there not being absolutes, so with a viral illness or a bacterial illness, numbers matter. And so if we get invaded or we give somebody 1 million copies of the virus, that's a lot worse than 100,000, or if we're invaded with that many. And so with that analogy, the shedding of the virus is thought quite likely to be much less in a vaccinated person, but there's not evidence that that vaccinated people would not shed it, as we see with other viruses as well. You know, one of the more common, well, there's a lot of common viral illnesses and vaccines. Probably flu is one of the biggest ones, where, as you know, when we get the influenza shot, you can still get influenza, but it'll be a milder case, and the odds of you spreading it to vulnerable people is lower.
So Eric, do we know that being vaccinated causes you to transmit the virus much less, or is that what we just suspect?
Yeah, I mean, to what extent you can know, you know, anything in science, you know, I think there's pretty solid evidence to support that. One, knowing just knowing when you boost somebody's immune response to other viruses, they're less likely to spread it. And then looking at groups, how well groups that are vaccinated versus unvaccinated seem to spread it. It doesn't seem to spread as dramatically among vaccinated groups. So when you extrapolate that, because to truly answer that question, you'd have to get a bunch of people get people vaccinated, then intentionally infect them, and then intentionally have them spew the virus. I'm sure ongoing, there are animal studies to try to look at those questions. But then again, so yeah, the short answer is no, the vaccine does not, people that are vaccinated still shed the virus, but almost certainly to a lesser degree.
Okay.
All right. And then what makes each variant different? Are the symptoms different? And does the testing reveal which strain an individual is carrying? So at the structural level, each variant specific to the COVID virus, a big part of it is the spike protein that we've all heard about. Like the Delta variant, it's the way its spike protein interacts with our own bodies. It allows it to skip one step. When the original COVID virus would get into our airways and attach to our cells, there had to be two enzymatic reactions that happened to make our body take it up. And Delta really just needs one. So that's one reason it gets into our body so much more easily, and it seems to be so much more contagious. The symptoms seem to be pretty similar, but with all viruses, there's a lot of variability. Viruses affect a lot of our cells, and different people respond differently. Sometimes kids seem to respond a little more differently than adults, but of course, the classic has been, the flu-like symptoms where you get fevers, ache, usually some respiratory symptoms, but sometimes people have GI symptoms. And then the real serious cases are when people have the inflammatory response. Tends to happen more in people that are overweight, where they can have blood clots, heart attacks, and that sort of complication. But anyway, to answer the question, for the most part, the symptoms seem to be fairly similar. So the next question was, explain the difference between being immune versus resistant. I don't know exactly. I guess we don't, we talk about immunity, just like I said, nothing in science is absolute. It's more of a continuum. And so we want to be, and nobody has absolute immunity. But the hope is to, whether it's because you've had COVID, unfortunately, or been vaccinated, to be as close as possible to absolute immunity, so you're impervious. There's, some of the evidence, they're finding some people that have been exposed a lot and have never had it, haven't been vaccinated, and some people seem to be genetically somewhat immune. There's a lot more to be understood about that as well. And so resistant, we use that term differently in medicine, so I guess I don't quite understand, but I guess they sort of mean the same thing in general, just that if you're immune or resistant, so that you can't get the infection.
Eric, can we consider COVID or look at it in the same way that we might look at flu? Like it seems to me like the flu is just it's kind of what we've accepted as part of life. And so I think that there's much less consternation about getting a flu vaccine. But Pam tells me some people that are still very up in arms about getting a flu vaccine. How similar should we be thinking about these things?
Yeah, I think it's from a public health standpoint, it's similar. The push over the years for the flu vaccine was primarily to protect the most vulnerable. The elderly, the very young, those that have immune susceptibility. And because viruses spread, from person to person, that herd immunity or approaching herd immunity is the best way to do it. But a secondary benefit of the flu vaccine is just that it's awful. Even if you're not going to die from it, I don't know if anybody's had true influenza, but I had it in med school, and I still remember I could barely, stay upright for 3 days, and you ache, and so there's a lot of lost productivity and a lost, and so that's sort of a secondary, motivation for the flu. So to that end, yeah, I think the biggest push for COVID is that it's most people don't die from it, but on a because it's spread it's so widespread, and even though it kills a small percentage, it as we know, it's killed hundreds of thousands of Americans. So yeah. So I don't know, I kind of rambled there. I don't know if I answered your question, but yeah.
That's good.
All right, the next question was about cloth masks. I heard last year that the cloth masks we wear are essentially useless for stopping the virus. Can you comment on that? And I've also heard that virus can enter through the eyes. So does that mean that face masks are essentially ineffective? So one distinction, of course, as we're all aware, a big part of the community mask wearing has been focused on just mitigating, just reducing the likelihood that we might spread it to another person. And somewhat that goes back to my invasion analogy. If I get 10 and, pick your invaders, if I get 10 invaders in my home and I can delay, instead of letting 5 of them leave, only 3 leave, then it's going to help my neighbor. And so I think with cloth masks, the ability to do that is not great. But because COVID is spread through droplets largely, those you've probably seen all those videos that are popular go around that show people talking in those droplets. So if you can cut those droplets down by an order of 50%, then you're going to at least reduce the likelihood of spread, but absolutely will not prevent it from spreading. Now, if people are in a high-risk environment where there could be a lot of COVID, like in a hospital, yes, it is good to wear eye protection because, if those droplets get on your eyes, they can get in. And then because cloth masks are not very effective, especially for protecting someone from getting the virus, they reduce a little bit the ability to spread the virus. That's when you'd really prefer to wear a good medical grade mask, like an N95 mask. Especially early on when there was such a shortage, a lot of the public health decision making about cloth masks somewhat was just to dissuade, all America from buying up a lot of medical masks just because they wanted to make sure that the front, the EMTs and the ER nurses that they could have access, the people in the high risk environments, but ideally, kind of getting back to the spirit of the question, yeah, ideally everyone, if they wanted to protect themselves and reduce spread, would wear an N95, but that's just not practical. And anybody that's worn an N95 for any length of time knows it makes for a long day. Yeah, go ahead.
Got a quick question. So have they figured out yet, or like boost? So like my wife got vaccinated in March, I think, and mine was early April. Have they figured out those are needed and how soon, what the time span is?
For
Or
boosters?
not testing yet?
Yeah, sorry, it skipped out, but I think you asked about boosters. Is that right, Kevin?
Yeah.
Yeah, or third shots. So yeah, as people probably are aware, for people that are severely immune compromised, they have decided that they should get a third shot because all along they saw people like on drugs for organ transplants, they just didn't seem to mount the same degree of protection. Boosters has been, is still not been decided on. So the part of what they're waiting on is just, still they're just not sure. A lot of people interpret the data to say that, gosh, the number of vaccinated people getting sick, per exposure now is a lot higher than it was, 3 to 5 months ago. And so a lot of scientists are saying that's evidence that the vaccine is losing efficacy, like some viral vaccines can. You know, it's kind of like going back to my invasion analogy, if you get the vaccine and your immune system says, oh, hey, all right, we're ready. And they put 100,000 guards at the gate. And then over time, they don't get exposed and it goes down to 10,000 guards. If you give a booster and you say, hey, immune system, remember this guy, and it puts 100,000, then that might be effective. Now, some other experts, though, are looking at it and saying, no, it's not so much that the vaccine is losing efficacy. They look at the numbers and can make the argument that it's the Delta variant. And then the third group is just that the third argument they say is we just don't have enough vaccinated people. And I'm not endorsing any of these arguments, but that's the third argument. Some of the scientists say, you know, because only about half are vaccinated, that allows enough of the virus to run rampant that it's enough to even overwhelm some of the vaccinated. So the FDA, the CDC, the American Council on Immunization Practices had so far has said they're not sure. Most people anticipate, though, that boosters will be recommended. I think the final piece of that comes in is, yeah, some people say, well, gosh, do we want to devote energy to boosters when we still have unvaccinated? Because there's not really a shortage, fortunately, in our country. You know, most people say that shouldn't be a deterrent. Let's see. So last Wednesday, President Biden said he wants to mandate the vaccine so we can protect the vaccinated from the unvaccinated. Does this mean that being vaccinated does not protect us? If that's the case, then why are we being vaccinated? I think that would speak a little bit to the argument I just mentioned for the booster, you know, the whole idea of herd immunity. If only 10% are vaccinated, but then they're surrounded by the virus in 90%, you know, that can overwhelm those guards, so to speak, going back to that invasion analogy. So, and then the CDC acknowledges that some have natural immunity to COVID-19. How can I tell if I have natural immunity? Is this because of having contracted the disease, or some are naturally immune? So there are antibody tests for COVID, but so far, partially just because it's early, but also because immunity is complicated, there's just not enough evidence to tell you that if we check and you have antibody levels, that tells us much about how immune you are. There are other viral illnesses like that as well, where maybe you've been exposed, but because they can mutate so quickly, it may not really explain immunity. Even for the vaccines, there was some initial thought that, well, we can check people's antibody levels to see if they're immune, but that just hasn't panned out to be adequate. One main reason for that is so there's two main systems for immunity. There's what's called humoral, or kind of bloodstream immunity, and then cellular immunity. And so again, going back to my analogy that you guys are probably getting sick of already with the invaders. So the invaders may come into your highways, your airways, and your bloodstream, but what they really want to do is get into your homes, which are the cells. And so the antibodies are there on the highways to try to attack early on. But once it gets into your cells, you have a whole new system of immunity that can fight that. And so they think that the vaccine immunity might be most effective because it helps develop good cellular immunity, and that's hard to measure with antibodies. Oh, and then, yeah, and then somebody talked about naturally immune. Yeah, there are some early reports of people they're identifying that they think may be naturally immune just because they've been exposed so much and never have gotten the virus, but why, they don't know. Can you explain specifically what it means to be vaccinated? Am I still as likely to carry the virus as if I was not vaccinated? Why are some who are vaccinated still being hospitalized? And if a vaccinated person can still carry the virus, then is the vaccine really helping to slow the spread? So I think I spoke to this a little bit. You know, that some of it has to do with degrees of protection and how much virus you might carry or spread. The rate of hospitalization among the vaccinated does seem to be going up, but it's still greatly outpaced by, in most areas, by the unvaccinated. You know, the majority, and certainly the severity of illness and deaths is higher amongst the unvaccinated. But yes, it is going up, and that's why a lot of thought leaders are making the argument that they think boosters may be necessary soon. Preventive measures include social distancing, masking, and vaccinated. There is also something about a 15-minute time window. Can you explain how talking with someone for less than 15 minutes is a preventive measure if it is? Two things. I mean, that 15-minute rule did come out before Delta. I think if Delta was the first variant, they probably would have made it a shorter time frame. But some of that just came down to, it's a bit arbitrary. With public health, they had to have some sort of guideline. You know, if I develop COVID and then they say, hey, Herrick, who have you been in contact with? I could say, well, I bought groceries and I talked to them for 1 minute. And so some of it, they came up with extrapolating from the data, just a rule of thumb. And so, no, it's not perfect. If you have COVID and you spoke to somebody for 5 minutes in close quarters, that, they still may have contracted it. So. If you had COVID last year, does that mean you do not need to get vaccinated? No, it doesn't. It seems, for whatever reason, and we'll see this with some viruses, the best immunity for the average patients that's had COVID seems to be from having both. There's variability in everything. So there may be some COVID patients that have high levels of immunity, but in general, looking at the numbers, there are a lot of patients. I've known patients that have gotten it twice and that hadn't been vaccinated yet, and their second time around was worse than the first. Now that's not science, not just looking at anecdotes from one doctor's experience, but yeah, when they look at the not just the U.S. data, of course, this is happening worldwide, and when the scientists have looked at this worldwide, they find that a good neutralizing vaccine adds a significant layer even to someone that's had COVID. What do you make of the 27% of healthcare workers not being vaccinated? Do you know why they would choose not to? Seems like their knowledge would cause 100% to be sure they're vaccinated. Yeah, I mean, healthcare workers are, people too, and so all the various, differences of opinion, exist across the spectrum. I saw that question. I meant to get more hard numbers on this and look at it. I know just, in our own hospital and some of the facilities where I work, I don't know. I hesitate to say this, but, it tends to be a little more prominent amongst the, like I know the doctors at our hospital, the doctors and nurse practitioners, I think, are approaching 99%, whereas there are some, there are a lot of workers in healthcare, and some have been through, less of the science training as others. And I only mention that because someone spoke to, wouldn't their knowledge base prompt them to be vaccinated at a higher rate? And so whether that's a variable, I just don't know. Like I said, I did mean to research that a little more, and I regret that I didn't. So. What valid arguments have you heard for people to not get vaccinated? Well, I think it's, you're doing something to yourself, and I get that. We all make, you're having a substance injected to yourself, and so there's that always understandably could give someone pause. I don't know the numbers, but definitely millions, probably hundreds of millions worldwide have been vaccinated with various vaccines, and it's being tracked very closely. And as far as serious side effects, there have been very rare compared to the overwhelming seriousness of COVID. But I think there are a lot of other trade-offs that we make for the public good, that you could argue, and I'm blanking, I think, because I'm feeling I'm trying to rush my brain to remember some of these analogies. You know, I don't think seatbelts are a great one, but there are a lot of trade-offs that we make for public good where you could argue that there's a 1 in a million chance that could harm us, but we make those trade-offs, for ourselves and others, because we understand the odds. And so hopefully, people can understand that, all these people that are, I hesitate to use words like pro-vaccine, but, that are encouraging the vaccine, have been there themselves and, are vaccinated and, take encouragement from that. Now, when it comes down to, actual downside, and I guess I'll speak specifically to the vaccines that we have in the United States. The J&J vaccine, there's a very rare risk of blood clots that's been demonstrated, and so they monitor for that. We know that anybody that gets a vaccine of any type, we know there's a very rare but low chance of causing what's called Guillain-Barré, which we can also get from viral infections. So probably the risk of getting Guillain-Barré from having COVID is higher than from getting it from the vaccine. And I'm not aware that there have been reports of it with the COVID vaccine, but we know it can happen from any sort of stimulus to your immune system. I know, I guess just while we're on the topic, I know some friends and patients I talk to, may reference there are a lot of numbers that are thrown out about, a lot of deaths and serious consequences. Those I've not seen validated. Some of those do come from VAERS, the Vaccine Adverse Event Reporting System. And I know when we first started vaccinating patients, we were encouraged to make sure we reported anything that happened around the time of the vaccination, because the public health leaders want to be on the lookout. And, just with J&J, they were able to pick up on this 1 in a million blood clotting risk because of that vigilance in reporting. I know some people, I've had people say, well, the VAERS reporting system, there's all these things reported, but those are just things that then they investigate to see if there's been any link, and there have not been links found. I know Steve texted me a few more questions, but I'm happy at any point, if you guys are sick of me droning on, to stop and field some questions.
There was one question, Eric, that you at least in part answered it already, but the last question was, is there a limit to the efficacy of the vaccine? If there's not, then why a booster shot? If there is a limit to the efficacy, then how can we develop a herd immunity that they talk about?
Mm-hmm. Yeah, and of course, there's no perfect vaccine, and so absolutely there are limits. And it seems like the level of frontline protection it provides people is probably waning fairly quickly, maybe in the 5 to 8 month time frame. Still people that are vaccinated seem to get less sick and die at a lesser rate even now, but it doesn't seem to be as robust a protection as it was early on. But like with the, so I think so I guess I answered that. It is the mRNA vaccines have, the science though has been very good with them. I'll mention this, I guess, I don't know if people are, so, there's a lot of concern because with the SARS vaccine efforts, they didn't go well because it seemed like when they vaccinated people, it would, and then when they got SARS, it might actually magnify their immune response. So they would get sicker. So they knew that in vaccine development, it needed to be shown to be highly neutralizing. So that's why there was so much excitement back in November and December in the medical community, because the initial studies showed that, lo and behold, it was very neutralizing. Now, how long it stays very neutralizing, time is tell. Obviously, that's diminishing. With herd immunity, of course, you can get it from having the condition or getting vaccinated. I think public health leaders, their fantasy, would be that 100% of people would get vaccinated. And then, like we talked about, it becomes harder to spread. Fewer people get really sick, and so that helps accelerate it petering out. So anyway.
I know I have another question, but there's definitely people on here that have kids, and I'm not sure that we answered any questions specifically germane to kids. So that might be really good to bring that up. Charmaine, if you're in listening distance, I know that you're working on some studies about Delta. I don't know. I don't know if you have any specific questions, or James, whoever, anybody want to chime in?
I had a question only because we jumped in a little too late, and sorry, I couldn't get the Zoom to work for some reason. I was just curious. I didn't know where do you practice medicine?
It's over by the hospital. It's it used to be called Reed Medical Group for years, and now it's called the main group's called Reed Internal Medicine.
Oh, in Kansas City.
No, here in Lawrence.
In Lawrence. Oh, I'm sorry. Okay. I just couldn't remember I couldn't remember. So I just wanted to ask that question. And then, so my mom is immune compromised, and she's already gotten her booster, but she lives in Maryland. So I didn't know, and her doctor actually called her to come in and get it. So I didn't know if that will happen in this area too, because that's the only person I've ever heard of doing that, but she's highly immune compromised right now.
I see. I know the health department sent out a survey, because they wanted to, just to be prepared for logistics, anticipating that a booster will be recommended. And so I don't know if they'll sort of use that like they did initially to alert people. I think it'll be big news. I have sort of my plan is to alert my patients when there's more crystallized, but I think all clinics may do it differently. I know LMH I think they sent something out, but it was a bit of a mess up, because it was not clear, and a lot of people that really weren't due for the booster got, so I think in their effort to send it out, I think maybe they pushed the wrong button and it went to some of the wrong.
Oops.
Yeah.
I have three questions actually, so you guys can totally interrupt in between. But first one is, I've heard that because there are some similarities between COVID-19 and typical flu viruses, there's been talk of mixing up a bit of a vaccine cocktail with future flu inoculation, so that you get your flu shot, you get your COVID shot, all wrapped up into the same thing. Probably using the mRNA, right?
Moderna is working, has one in early trials that's flu, COVID, and also RSV. You talked about kids, and we've seen it.
We have two. That was one of my other questions.
Yeah, and RSV has been running more rampant than usual. I mean, it's very interesting to try to figure out why the heck all these winter viruses, and there's obviously people have theories that make sense. But anyway, to answer your question, I know Moderna is working on an RSV flu, and anyway, COVID.
The related question with kids, we've got pretty young kids, a 5-year-old and a 7-year-old, and I know anytime we take them to the doctor for checkups, whatever, and they have even the slightest little sniffle, like our daughter went a couple weeks ago, and she had a little bit of a cold, and they gave her a COVID test just to make sure that it wasn't actually COVID. Mm-hmm. Can you just describe what you know of typical symptoms for young kids? Because I know in most cases it doesn't seem to affect them as much.
Yeah, but they do ask us if we want to give them the test or not. So it's not that they force us to do it. They do ask. However, it kind of freaks me out, because I'm like, the kids are going to get colds. Like, they're not just They don't always have COVID.
Yeah. Yeah. I mean, fortunately, as you know, I mean, it's, I mean, for the great majority of people, well, anyway, for kids, it's usually not too bad. And, but there's, of course, with Delta running around, the big concern is, with opening schools is these major outbreaks that, if nothing else, shut down schools, put teachers at risk. And then, there's been an increase in hospitalization in kiddos. Just like anything, if you say, well, only 1 out of 200 kids gets really sick. Well, if you look at how many kids are in school, that's still, that's our neighbors. We know a few, we're going to know a few people with at least kiddos in the hospital. And I know from how, even if they're not going to, they're probably going to make it, it's still, that's a lot to go through. And so, so that's the concern. And then when it's running rampant, and then just, in medical care, our threshold to test for something sometimes, is tempered by how rampant it is. I don't test for TB much anymore, because TB is called the great imitator. It can do anything, but we don't test for it very much because it's just, there's not a lot of it around. Forbid if there was a huge TB outbreak in town, we would start testing for TB a lot if people had respiratory symptoms, because we just want to say, well, maybe it isn't, but gosh, I'd hate to miss it and find out 2 weeks later you spread it to 10 other people. So that's kind of the reason for the vigilance. And yeah.
So Will has a question. Kevin, was your hand up too?
I think did you have one more? We can get back to it.
It was mainly about like the differences in mRNA vaccines between the Moderna and Pfizer, because I know you can't really mix and match. And I was just kind of curious why that is, but we don't have to get into that here. That's a technical question.
They're pretty, I did a talk on the vaccines a while back, and so I was a little better equipped, but they're pretty darn similar. And I haven't heard it explicitly, but I think, if the world ran out of Moderna, my understanding is they'd say, well, just go ahead and do Pfizer, but if at all possible, stick with, with what you did first. So, okay. And who was next, I think?
I can go. So I had heard that the virus can spread similar to cigarette smoke. So like if you're in a room full of people and, kind of like if you're in a room full of people and somebody starts smoking and like you're in the back of the room versus them being in front of the room, like you can smell the cigarette smoke. I've heard that the virus can spread in a similar way. Is that true? That just being in a room and like, say you're in a room with a large group of people,
mm-hmm.
and maybe 2 of them have the virus. If I'm in that room for an extended period of time, could it spread to me just from being in the same room, or does it have to be more direct contact than that?
It could. Early on, that was a big question, whether it was just droplet. Droplets are bigger than aerosol. Aerosol is what you're describing, where it can just get in the air and float through. And there was a really interesting study out of one of the China exposures. I don't know if it was pretty it went around a lot, but they demonstrated in a restaurant how there was an outbreak, and the people sitting at the tables where the vents were blowing the air across them, they're all the ones that got COVID, and the people sitting to the side of the vents did not. And so that was one of the early, indicators that they said, okay, we know it's mostly droplets, which requires that close contact that you spoke to. But you can get it in the same room. So now the risk is probably lower, and that goes back to that analogy of, are you talking face to face for 15 minutes, and so you get exposed to 10 billion viral particles, or you just got exposed to 1,000 because it was in the room? And then some of it's dumb luck. How many of those guys planted and got a foothold, and does it cross that threshold that it takes for you to get infected?
Okay, so it sounds like the risk is a little lower. Okay.
Right. But as time's gone on, they've looked at it, they've realized, the answer to the question of whether it's aerosol are aerosolized beyond just droplets? The answer is more clearly yes.
Okay, thank you.
You're welcome.
Did you want to chime in at all, Charmaine?
Have you found anything new in your research? You're muted, don't forget.
We don't research the virus ourselves. We look at other people's research.
Gotcha.
So, but I'm teaching an immunology class, so we talk about it a lot.
Oh, wow. Yeah. So you could probably speak to cellular immunity quite eloquently, a lot better than I.
All right. I had one or two questions real quick, and I don't know how many other questions are floating out there, but throw them out.
Yeah, and please ask them. I have talks with some patients and friends, and that think I'm all wet, and that's fine. Like I said, I think dialogue's important. So yeah.
Last year, there was, well, I know that all of us that have asked questions start our questions with, well, I heard this. And, so it's all just kind of hearsay. But so I did hear this. Apparently there was a COVID, as COVID tests were being sent to be analyzed, an unused COVID test was sent in this batch. And apparently the unused COVID test came back as being a positive. So it was a false positive. I'm wondering, how reliable do you feel these COVID tests really are?
I think they're pretty reliable. Yeah, I remember hearing something like that, and yeah. Anyway, and getting some reassurance that that there wasn't much to that. Tests are absolutely imperfect, and so there are false positives and false negatives. But unfortunately, I've had a lot of patients with COVID, and almost all the positives, especially here lately, they've kind of fit the bill. They lose their sense of smell. They feel, fairly crummy for a couple weeks, and so it certainly seems like more than a cold. And anyway, I guess the other, when I saw some of that information, I guess just, kind of taking a step back, I'd say, what would be the, if they're wrong, I mean, I think there's no doubt that there's something going around that, that causes a very similar illness in a lot of people that can be, is making a lot of people sick, and, keeping my hospital colleagues very busy, and, yeah. So anyway, it's kind of a rambling answer to the question, but yeah, I do think I feel pretty good about the tests. And I've had a lot of patients do antigen tests. They'll get sick, and then they'll go get one of those rapid tests that you can get over the counter. And all of them, that have been sick, that have been positive, then when we do the PCR, so far they've all been confirmed. They're not known to be 100% accurate, but yeah, I think the tests are pretty good.
Okay, great. No, that wasn't a question, it was a comment. Jim, did you have anything that you wanted to add or say about observations that you've had? Eric, I'm not sure that you know James Holt, but he's a nurse over at LMH.
I think so. I know that name. Oh, is that? Yeah. Hey.
With the hat on.
Yeah. He doesn't wear a hat at work. So.
Not that one anyway.
I do now. Steve, were you asking me a question? I'm sorry.
Yeah, I said, is there anything that you wanted to add, or, because you've had observations that a lot of us haven't had, just being up close and personal in the hospital, or anything that you wanted to ask about?
I don't have any questions. I think, as far as my observations, we've definitely cared for patients that have been become inpatients that have been diagnosed with COVID. Most of those have been on the pulmonary side through our group of physicians that do bronchoscopies and stuff like that. We've had a few too that have come that we've had to do other procedures on, but I'm pretty regulated by the hospital guidelines, which I think Dr. Herder talked about more specifically. Eye protection. I mean, we have kind of a whole nother N95 mask, stuff like that we have to wear pretty consistently. And when I'm in procedures for our unit, we're required to, unless a patient's intubated, we have to have the N95s on. So I don't know that I feel like I have anything to share that would be necessarily helpful to this conversation outside of what Dr. Herder's already spoken to, but I think it's been a great discussion and great, very informative. So
good. Any other questions, copies? Is Gloria there? Anybody?
I have one more question. So I'm a teacher and I'm a specialist teacher, so I see a lot of students. And I just wear a cloth mask because I'm with the kinders, first and second graders, so not the older kids. And we've only had a few cases in that level. But I tried to wear the N95 for a while and I couldn't teach with it on. Mm-hmm. I was suffocating. And so I guess my question is, soon my immune compromised mother might be in the area and I might see her more frequently. So I guess my question for you is, what can I do to protect myself when that happens so that I am as cautious as I can be for her health? I mean, does that make sense? Mm-hmm. Like, I mean, obviously I would be willing to wear that if that's what would help me to be safer around her.
Yeah, it's hard. I think of it again as a spectrum. And of course, the safest thing you could do is quit your job. And I mean,
the thought has crossed my mind.
Yeah. And never go near any person again or see your mom. And none of us want to do that. And so, I think that's kind of where things go. And, it was nice a few months ago, we were all getting, whatever our risk level, we were getting to walk that way. The mask recommendation was eased and the gathering recommendations were eased, but then of course, things got hit ran. And so, specific to your case, I think you want to think about what are all the things that you can do to move that way, within reason. Mm-hmm. I don't know what you said, so you move, and because if you move from classroom to classroom, but
in my own classroom, I just see
all the other kids moved to her classroom.
Now they do this year. Last year we did different mitigation strategies.
But that's where the challenge lies, it's just that, is just that who you're coming home to, with your mom. And so, but I mean, I guess I don't really have anything great to say other than, I think, one other question is whether to do surveillance. I have some patients in situations like that, and they may, opt to test themselves weekly, just, because that's one of the other very challenging things about this virus is a lot of people are, it's a high level of asymptomatic spread. And you can say, oh, hey, mom, I feel good. And, maybe I am wearing an N95 most of the day. And of course, making sure I wash my hands and do my best. I noticed as I was talking, I was touching my face, which, that helps to reduce spread. And I don't know if you wear glasses, but you could add eyewear. But then on top of that, just to make sure you don't bring it to her asymptomatically, you could, get one of the, I forget what they're called, the buy something over the counter, the antigen tests, or you can see if your doctor would facilitate you getting like weekly surveillance tests.
That's a great idea. That's good to know for when that happens in the future. Okay.
And Mr. Hopkins brought it. I mean, it hasn't been enough of a topic, I think, maybe because it's so challenging, but of course if she's going to be coming during the winter months, I don't really, I mentioned, ventilation, but I don't have a lot of, I mean, I've looked at it some, I haven't looked at it recently, but that could be another thing you could do in the home is just, do a little bit of research to figure out the best way just to, to make sure your home's as well ventilated as possible, so the air is not recirculating. But again, when it's cold, that's that's kind of hard to avoid. So.
I have a question. I'm going to try to ask it quietly. We have a teenage daughter who has a boyfriend. Both of our daughters are vaccinated, but the boyfriend is not vaccinated and his family isn't either. And they're also in contact with a lot of people. And it's pretty tricky because, well, for example, he was quarantined from school for 10 days, but his mom let him come to work with him. And he went to, with her, he went to the football game and things like that.
Mm-hmm.
And so our daughter is asking, like, if he gets tested and he's negative, can I hang out with him? But the school said no to him doing the daily testing and still coming to school since he's unvaccinated. And so I was just wondering if you had any guidance for us. It's a pretty charged situation at our house.
Yeah, I mean, it's such a, of course, the pandemic's a tragedy in itself, but yeah, the division it's led to is so tragic. Gosh, yeah, I mean, I think that, if there's someone high risk, I think it comes down to making hard decisions and then, trying to, to weigh the consequences, sort of think it through. I mean, what is the downside? Well, yeah, if it is a young person, they're more likely that they could be asymptomatic, the whole time and then spread it to you. And I know that, James works in healthcare. I mean, he's taking all the, he's wearing all the PPE. So even then the likelihood that he would spread it is very low. And I don't know beyond that, if you guys are coming into contact with vulnerable parents or grandparents or
I mean, it's similar situation.
And as part of that, not, hopefully, again, just not making it, a decision based on his decision, to say that, hey, if you're not going to think the way we think, we're going to do this, but just to say, hey, we care about you, but because of this domino effect, if you're not, we may have to seriously consider taking these steps to protect, whoever the vulnerable people may be. Not to say that any of us, 1 in a few hundred chance could be vulnerable, but yeah. Anyway, that's. It'll be. I can't wait till it's over, for the health aspects, but especially for the societal, so we can not, at least have one thing taken off the table that's adding to the divisions and the conflict.
Yes. And to that point, thank you for answering these questions with a lot of humility and diplomacy. It's very helpful.
No, well, thanks.
Eric, so the reason that we're on this Zoom call right now is there's some discussions that got started in a fellowship of people that go to the same church, and maybe everybody on the call is in the same church, maybe not. I'm not really sure, but that a number of people here are, and so we enjoy a very, very close fellowship. And right now, the stance of the congregation is to stick with the CDC mandates as Douglas County has interpreted them. And, so we'll stick with the mandates that are given to us by Douglas County. And so that's as far as the church goes for what she says we need to do when we're in fellowship together. So that right now, we might go into a room where some people are masked, some people aren't. There's a high degree of fear in some folks, and some folks are more laissez-faire about the importance of masking, getting vaccinated. You know, I was actually surprised not long ago with people that I thought might have been vaccinated that actually weren't. And so both Pam and I realized, oh, we're assuming things that aren't necessarily, we have no evidence for, like we're assuming people are vaccinated when they're not necessarily. So we had to talk about, well, what does that mean for us and how we conduct ourselves? So I guess my question is, for people that are afraid and afraid for their kids, and don't want to sequester within four walls, how can we feel safe? So if we've been vaccinated, can we feel safe? We get vaccinated, we wear masks, we wear our own PPE. Feel safe in that situation? Or, you know, it sounds like there's no certainty to any of this. So maybe we can feel as reasonably safe as we could in any other given situation where everybody is fully vaccinated and everybody is masking or something like that. You know, I don't know. Can you help us to know the temperature that we should feel in our own hearts? You know, that's a really complex question, and I'm asking you for an opinion, and I know that you want to be objective. And so anyway, there you have it.
Well, yeah, I mean, I think if you're vaccinated, you know, I think the evidence is pretty solid that you can feel safer. You know, again, as I, you know, this summer when, you know, I had a few a few elderly patients in a nursing home where a staff member had COVID that got exposed, and they were the sort of people that last year, some of them would die and they had no symptoms, you know? And so I thought, man, that vaccine's working great. You know, the past month, you know, I just talked to a guy today who's vaccinated. I think he's 84, you know, fairly robust guy, but you know, he's on his second week and he's just like, when will this end? You know, he didn't have to be hospitalized. And I, you know, and again, those are anecdotal, but I feel like they also kind of represent what we're seeing. Anyway, I've covered that. So yeah, so I think to navigate, you know, and fellowship is important. And, you know, so for those people, yeah, I think if, you know, if they, you know, want to wear full PPE for extra protection, I guess, and, you know, just because that's, if, you know, fellowship's usually shorter than an 8-hour day. I don't know about your church, but, you know, so maybe that's, anyway, yeah, I mean, like you said, I realize I'm just babbling. I don't really have any, I don't know how to answer that well. And then yeah. And I guess I wondered if your question was going whether, you know, about the idea of mandating, you know, organizations, you know, mandating vaccines, and, you know, that's a very divisive issue. So, yeah, I mean, I absolutely respect the right of any organization to do so. And there's part of me, because of my bias, that likes it. But then philosophically, you know, when I step back, you know, certainly there's part of me that, you know, that doesn't, you know, like that people feel ostracized just because they feel differently. You know, I feel my hope is that they eventually will come around to, you know, feeling more positive about it, just because that's what I truly believe. And yeah.
Well,
So, Eric, oh, I'm sorry, go ahead.
Oh, I was just going to say, at least the idea of a mask mandate, that seems less invasive, but more protective for everyone. But that's been a little bit controversial since everything has become so politicized, and since there's not technically a mask mandate in place for Douglas County right now.
Yeah. 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 And as somebody said earlier, yeah, I mean, the masks, are they, you know, super dramatically effective? Maybe not, you know, but there's enough evidence that it, you know, probably helps. And, you know, if you can keep one person from infecting, if they only infect 4 people instead of 5, exponentially, that adds up pretty quickly. So
So Eric, just humanitarian wise, in my understanding, the non-vaccinated are more obviously susceptible to getting an aggressive strain just because they don't have that barrier of immunization. And so really the concern I have for my unvaccinated friends is concerned that they're going to get sick. And so it's not so much, I feel pretty confident about, the vaccine and those kind of things, but my concern more is not, we need to mask up or do this because we might possibly get sick as the vaccinated. That could happen. But my concern genuinely is for my friends that are unvaccinated, because really they are the vulnerable. Whether they choose to be vaccinated or not is their decision, but they really are the vulnerable ones that will have the more catastrophic result in the end. So like I go between two ways. It's kind of like, it's easy to think, oh, I need to protect, but really what I'm doing is protecting them from any shed or spread that I'm going to give. Is that correct thinking?
Oh, absolutely. Yeah. You mean by virtue of you being vaccinated or you wearing a mask or both?
Right. But they're really the one that our friends that are unvaccinated are really the most susceptible, that we need to be concerned and worried about. And for, various reasons of not being able to be vaccinated, whether they're,
No,
a
absolutely.
friend that just finished stem cell but can't be currently vaccinated. I mean, that is somebody we want to protect from exposure. As a community, are we trying to, getting to the point of really, we want to protect the unvaccinated among us from exposure, which includes children under the age of 12. So anyway, I try to.
No, I think that's
thinking.
No, that's, I mean, especially for this gathering, if it's a group that, gathers to, because of their shared, wanting to share Christ's message, then I think that's a really good way to look at it, So.
Yeah,
I have a question about singing. I know that one of the reasons why I wear a mask at church is so that if by chance I happen to be singing and like something would expose someone else, I am vaccinated, but I didn't know. Sorry, my child. Is that something to be concerned about? I think that's where my mind goes when.
Yeah. A lot of the, there's because of the main spread is through droplets. If you talk, your droplets are going to go like this, but yeah, if you belt it out, there'll be more droplets and they'll go farther. So yeah, absolutely makes sense. So.
It doesn't alter your singing voice at all, Shay.
Doesn't. I still sound terrible. No,
it hasn't helped mine at all.
I just suffocate a little bit more with the mask on.
All right, we're gonna bring this in for landing here. Anything else pressing that people are thinking? No, it sounds like that's a no. But if you're talking and I just said that, that means you're on mute. So anyway, Eric, thanks so much for.
Oh, you bet.
Time.
Thank you. You're a very good teacher.
Sorry, I was late. What's that?
You're a very good teacher. You are. Very good explainer.
Oh, well, thanks. I like talking, so. You're safe from my droplets.
That's true.
Good night.
All right. Good night. Thank you.
Thanks so much.
Bye now.